There are some breeds that it is normal for them to have a malocclusion. However, that doesn't mean that it might not need some treatment. So one of those breeds that everybody's familiar with is boxers. So boxers typically have that classic underbite or class 3 malocclusion. So their lower jaw is longer than their upper jaw. And again, this is normal for their breed, but the problem we see is that because of that, the upper incisors hit the tissue behind the lower incisors and cause trauma. So that can be very painful, as well as eventually cause disease of all of these lower incisors because we're creating these holes behind them. And also the lower canines. So commonly in boxers, that incisor, one of the incisors, lateral incisors, is hitting on the inside of that big canine tooth and causes a groove in the tooth and in the bone surrounding that tooth, eventually causing disease. So if this is treated early on in their life, when those adult teeth come in, we see that it's causing trauma, we can extract or even shorten some of those incisors to prevent that trauma and keep them comfortable and prevent infection of those lower teeth down the road. So something to think about. The other malocclusion that we see less commonly is an overbite. So the top jaw is longer than the lower jaw. So this is a class 2 malocclusion. And this is oftentimes much more traumatic and something we like to treat very early on, especially if the puppy teeth are like this as well. Because what happens is the lower canines end up hitting on the inside of the upper canines and causing severe trauma and pain to the tissue on the inside of that upper canine tooth. And so, this is painful when they're puppies too. So we will treat these as early as 7-8 weeks of age to get those puppy teeth out of there so they can close their mouth comfortably. But that also gives the jaw every chance to grow maybe a little bit longer, and the adult teeth every chance to come out where they should be so that they can keep them. So be thinking about those in very young puppies and referring if you need to get treatment done early. So those are the two most common malocclusions that we see. There are many more that are very less common, but those are the two I'd be thinking about when you're looking at your pet's teeth, or for veterinarians when you're doing the oral exams on their annual exams. Be looking for those, because the sooner we treat them, the better. So if you want to learn more, you can go to our website at mainlyvetdentistry.com.